Hello everyone. So finally, we got the update that we have been waiting for so long. No, I'm not talking about the Mahesh Babu Rajamouli film. I am talking about the NEET PG counseling. My friends and my juniors have been asking me regarding emergency medicine as a branch and whether to put it in the counseling or not. So this video is to discuss about the advantages and disadvantages of taking emergency medicine. If you ask me to define what emergency medicine is, I would probably tell you that it is the first few interesting and important hours of every other specialty. If a patient is coming to the emergency, we don't know what problem he is having. So our job is to find out what it is, stabilize him, resuscitate him, take the help of other specialties if required, and once we stabilize that patient, we will transfer him to the concerned department. So put it in a nutshell, emergency physicians are jacks of all specialties and masters of resuscitation. Coming to the advantages of taking emergency medicine as a branch, the first thing I would tell you is that since it is a new and upcoming branch, you'll have plenty of job opportunities both in government sector and private sector once you finish your residency. The second thing is the unique skill set that you are going to attain. You will have theoretical knowledge about emergencies of different specialities. You will have practical skills like life-saving procedures that you do, emergency intubation, putting central lines, arterial lines, emergency cardioversions. Since you deal with trauma cases, you will be trained to do few basic suturings, fracture reductions, splinting, ICD placements. And apart from this, you will be trained in ultrasound too, what we call it as POCUS, point of care ultrasound. So you will be trained to do ultrasound guided procedures, ultrasound guided nerve blocks, screening echoes, DVT screenings, EFAST scans, and so on. So with these unique capabilities, you will have many applications later on. The third thing is the work-life balance. So this is kind of tricky. In the emergency department, you have usually shift-based system. So it will be already decided when you go to the hospital and when you come out of the hospital. Based on that, you can plan the rest of your day and you can attain little work-life balance. The fourth thing is the monetary compensation. Emergency physicians are very well paid in the corporates, whereas coming to the government sector, the pay remains same across all the branches. Fifth thing, I would say the most important thing is the amount of satisfaction that you get by saving lives of a patient. So that Now, let's discuss the disadvantages of emergency medicine. The very first thing is burnout. Emergency physicians experience the highest rate of burnouts because of the obvious fact that they deal with very sick patients and anxious attenders all the time. And the number of night duties that they do will just add to the burnout. The second thing is the huge, immense pressure that you need to make quick decisions, and sometimes you may not have any help. The third thing is you have to be a team player. For example, if there is a patient suffering from heart failure or MI, you need to involve a cardiologist. And sometimes there will be a very fine line where you can make decisions. Because the patient will be later taken up by cardiology team, you might sometimes need to follow their guidance rather than your clinical judgment. Fourth thing is recognition. Sometimes patient will be very sick when he comes to the ER. He may be unconscious. You will resuscitate him. You will, if he's in a state of cardiac arrest, you might resuscitate and bring back life to him. But the problem is the patient may not remember you. So sometimes you may not get thank you from patient, but that satisfaction of reviving him will remain with you. So you get less thank yous, but you will be recognized by other specialties and even patient attenders. So that is something to look for. So to conclude, emergency medicine is really exciting branch where you can learn lots and lots of skills. So if you decide to take up emergency medicine as a branch, don't forget to speak to the seniors who are already pursuing emergency medicine in the institute of your choice. So I have finished 1 year into my emergency medicine PG. So I'll be making a video shortly with all my experiences that I've been through in this 1 year. So make sure that you subscribe for the further videos. Thank you.